We've all been there. You are at your dental checkup and you know the one dreaded question is going to come up very soon. Which question am I talking about? I think you know the answer already. It's the "so, how often do you floss?" question. And while you know that the answer should be daily instead of never, which is probably closer to the truth, you're probably going to answer saying something like, "sometimes." And while you hear yourself saying that, you and your dentist both know that this is probably not the truth. So who am I? I'm Christina, I'm a dentist, and my mission is to make you as passionate about taking care of your teeth as you take care of the rest of your face. And today I want to help you finally stick to a flossing routine by listing all the incredible health benefits that you get from it. I actually think it's quite fascinating that out of all the things that we do on a daily basis, flossing is the thing that we like to skip. Because if you think about it, it is super cheap and it only takes about 2 to 3 minutes per day. So comparing it to all of our other things that we like to do in terms of beauty routines, it's actually nothing, and yet the health payout if you do it on a regular basis is incredible. And I think this is where the problem actually stems from, is that people don't really know why they should be flossing, and I see that on a daily basis with my patients. When I ask them that infamous question and they lie to my face, that most of the time they don't understand how crucial and important it is to floss on a daily basis. And so they think by brushing their teeth 2 to 3 times a day for 2 to 3 minutes, that's going to be sufficient. But the truth is, actually brushing your teeth is maybe 50% of the equation, and the other 50% really do come from flossing. But still, I feel like flossing is seen as something only health freaks do, as some part of elitist healthcare routine, when in reality it's something that we all should be doing. So I'm gonna get you there. Okay, so let's start with the most obvious. Think about how your teeth feel like in the morning when you wake up before you have brushed them. If you run your tongue over your teeth, they're probably going to feel a little bit gross, and you know that your breath probably isn't that fresh. But getting rid of this sensation is fairly easy, because you know that by brushing your teeth in the morning, you're gonna get rid of that weird foamy, fluffy feeling, whatever you want to call it. So you brush your teeth for about 3 minutes and you're probably doing a really good job at it too. However, there's one area that is often really forgotten about, and that's the area between your teeth. I don't know why I needed to make that hand movement. I just want to make sure that you can envision it as much as you can. So the area between your teeth, that is also called the proximal space. And if you think about it, and also if you see how your toothbrush is engineered, you don't have to be a genius to figure out that no toothbrush available to this day is able to clean between your teeth. And so what happens in an area where you never ever shed light into with a toothbrush or floss, you can imagine all the stuff that is building up in there. So we're talking about yesterday's breakfast, lunch from 3 days ago, maybe even from last week. Honestly, and I don't mean that as a diss, I think most of it comes from not really knowing and not really paying attention to these areas, but like the amount of stuff that I can get out of the proximal area for my patients, it's just, I mean, Christmas was what, 6 months ago? So while you at this point have forgotten about all the things that you have eaten during the past 6 months, there are people, let's call them bacteria in your mouth, that have not forgotten about it. And they're very happy about finding all of the deliciousness between your teeth. And actually, by not flossing, you keep feeding those bacteria that live in your mouth. And I don't want to generalize, because as you know, there's a lot of talk about gut microbiome. There's also the oral microbiome. A lot more research is putting into this area, which is really important. So you'll always have bacteria in your mouth. It's just about a balance between the so-called good guys and the bad guys. So at this point, we're talking about the bad guys. And by not flossing, you provide them the perfect breeding ground. That means they can process all of the stuff that is between your teeth, feed off on that, and build a biofilm that is then sticking onto your tooth surface. And a biofilm that bacteria live in and have produced and live off is very difficult to remove. And it's not going to be removed by using mouthwash. It's not going to be removed by using using a conventional toothbrush, the only way you can get rid of that biofilm is by flossing, because that's how you actually reach those surfaces. And if you think about it, if you don't floss, you basically have two surfaces on a tooth that are never ever being rid of that biofilm, hence never brushed, hence never cleaned. And let's get back to that sensation that you feel in the morning. Imagine that times 10, but between your teeth. And that is also why when you do start flossing, I always recommend my patients to start smelling the floss, because it's so gross. And if you think about it, that's how you interact with the world. And I find this is a big motivator for people to start flossing, because nobody wants to run around with bad breath. Okay, let's go back to the biofilm. I hope I'm not too nerdy at this point. I'll make it short and sweet. Long story short, the more biofilm you have, the more bacteria you have in those areas, and the more undisturbed they are, the more they can actually start working on your teeth by getting out the minerals and actually building a cavity, also called caries, that is slowly progressing towards the nerve of your tooth. And the tricky part about caries in that area is that from the outside your tooth tends to look perfectly healthy, and only when you start being in pain you notice, and your dentist at this point, that there's a cavity and hence a problem. And the further this progresses, the more likely you're going to have a root canal and everything that comes after that. So long story short, it is much easier to preserve a healthy tooth than to open the array of all the expensive, labor-intensive, painful, nerve-wracking things a dentist can do to you. So flossing or using interdental brushes is the only option that we have for now to rid ourselves from harming biofilm that is accumulating in the space between your teeth. Can't believe I did that again. Okay, on to the next point, which is fighting permanent inflammation. So if you don't floss, the chances of you having inflamed gums is very high, because as I said, you have all these bacteria that are accumulating, that can multiply without you ever doing anything against it. And as a natural reaction, as any other body part, your gums react with inflammation. And that is not very visible to you as a patient or a human being, because most of the time people don't really look at their teeth, only maybe the front, probably the front, and most people don't actually pay attention to their gums. It's normal, I get it, it's normal. I'm not gonna gum shame you. However, what I do want to point out is that as you would be worried about any permanent inflammation in any other body part, you should equally be worried about having a permanent inflammation of your gums, even though it doesn't cause you pain, but I'm going to get to that later. So the beauty of science is that more and more is understood about how our oral microbiome not only has an effect on our oral health, but also our health in general. And while you know by now that bacteria and the biofilm that they produce are harmful to our teeth, they're equally harmful to our gums. And even though it is common knowledge that permanent inflammations in our bodies are bad for us and our overall health, the problem with gingivitis, which is the medical term for inflamed gums, is that many people, as I said, are not aware of it even being there. And while you might experience some bleeding of your gums every now and again, it's likely that you're not going to be in pain. And I think that's where the problem comes from, is that people aren't really aware as to how bad it is because it doesn't hurt. And I think if gingivitis or inflamed gums were to hurt, a lot more people would floss naturally. And ultimately, beset gingivitis can turn into periodontitis, which is a whole other topic on its own, and I'm not going to go into full detail, but ultimately what can happen is that your jawbone starts to shrink, and you can imagine with it shrinking, your teeth are going to loosen, and eventually you're at a risk of losing all of your teeth. I mean, this is very much end of the world case type scenario, but it is very likely, and gingivitis is actually the start of that. But apart from losing all of your teeth, which is bad enough, research increasingly finds out how poor oral health impacts the rest of our bodies. For instance, people with a prolonged gum disease are at a higher risk for a heart attack, for developing cancer, but also Alzheimer's disease. So in short, short, the less you floss, the more inflamed your gums are. And as a side product, the pockets between your teeth and the gingiva or your gums is going to enlarge, which means that more bacteria can settle in and sort of hide in a pocket where you can't reach them and where they can further multiply but also harm you. Okay, that was maybe a bit heavy, but let's focus on the good news. The good news is when you floss, you remove those bacteria and thus create a healthy environment. And it's actually really motivating to start flossing because at first it's gonna bleed like there's no tomorrow. But what you'll notice is that once you start flossing, and by the way, it doesn't really matter if you floss in the morning, in the afternoon, or in the evening, as long as you floss once daily. But what will happen is that you will start to notice the payoff relatively quickly, because you will notice that first of all, your gums are going to stop bleeding. So while at first probably every single surface is going to shed some blood tears, only after a few days, up to 2 weeks, you'll notice that's gonna stop. And you'll also notice the difference between your gums, meaning at first they're likely to be looking a bit puffy, probably at a deeper pink or even red. And the more you floss, you're gonna see that they're going to deflate, and also a light blushy pink is going to come back, which looks much healthier, believe me. So I found that really motivating, and also my patients tell me that they've noticed a difference, and at least they tell me that now they stick more to it. Some of them. Not all of them, but some of them. Also, I'd like to mention that gingivitis is reversible, meaning that it is an inflammation that you can cure. So after having gone all gloomy and gloomy in the previous section, I want to come to my last point, and that is highlighting the feel-good factor of flossing. I know it sounds super cliche, but sometimes feeling good about ourselves means celebrating the small wins, regardless of how small they are. And from a dentist point of view, incorporating flossing as a daily routine is actually a pretty big deal. Oftentimes we tend to set ourselves those highly ambitious goals, you know, like hitting the gym several times a week, going for a jog several times a week, cutting out sugar, eating healthily. And while those goals are super important, and you know, it's great to have ambitious goals in your lives, it's equally important to incorporate some smaller, more achievable goals into these types of routines as well. And I also know that a lot of you guys are more likely to hit the gym on a regular basis than to actually floss, so the whole perspective on what is a highly ambitious goal and what isn't is probably highly down to personal preferences. Yet by flossing, you're able to incorporate something that is actively working towards your health and maintaining your health on a daily basis without having to lift the heavy weights. Get it? So flossing on a daily basis counts as much as taking care of your overall body health, and I promise you, if you stick to it, you don't want to miss it anymore, and it's gonna make you feel super proud and happy about yourself. So I hope with this video I was able to show you that flossing on a daily basis is equally as important, if not more important, than putting on moisturizer and sunscreen on a daily basis. So don't let flossing be one of your dusty New Year's Eve resolutions that you stick to for maybe 1 or 2 days, but really try and maintain a routine where you've incorporated it into your daily life and just stick with it. Let me know in the comments below how you're doing with it. Also let me know if you found a trick or a small thing that helped you to incorporate it on a more regular basis, daily basis. Daily basis is the keyword here. Then let me know in the comments below. Also help others by sharing how you've come along with it. If you're interested in more dental talk, I made a video about how to glow up your teeth and your oral health care routine in a video that we're gonna link somewhere here. That's it for now. I hope you have a great day and hopefully see you in my next video. Bye!